This is Walter Freeman, MD, PhD, March 9th, 1968. I'm 72 years old now and traveling around the country in a Cortez camper. In the past 4 weeks, I've come 7,000 miles chasing up patients that I've operated on and saying how they are getting along now, anywhere from 2 to 30 years after their operations. There are quite a few of them scattered through the South, and I guess there's some 42 in Florida alone who migrated here and apparently are enjoying it.
You just heard the voice of a man who considered himself a medical pioneer, a man the press once hailed as the father of the lobotomy. His name? Walter Jackson Freeman II.
A lobotomy was a procedure designed to cure mental illness by severing connections in the brain's frontal lobes. Freeman turned it into a spectacle, a fast, brutal intervention using what looked like an ice pick, hammered through the eye socket.
From 1946, when he began performing these transorbital lobotomies, until 1967, when he was finally banned from operating, Freeman conducted more than 3,000 of these so-called procedures.
What he didn't mention in his diary tapes, that over 100 of his patients died, many during the procedure itself. One died while Freeman paused to pose for a photograph, and countless more were left incapacitated, incontinent, or stripped of speech and personality.
They weren't healed, they were silenced, forgotten and warehoused in institutions and nursing homes across America. Were they victims? Absolutely.
And that leads to the uncomfortable question: was Walter Freeman a reckless medical zealot, or something much darker? Could he have been a serial killer, and a psychopath to boot?
That's what we're here to find out. In this two-part investigation, we're dissecting the life and legacy of Walter Jackson Freeman II.
And we're asking, was he just dangerously misguided, or the smiling face of medical horror?
You're listening to Psycho Killer, Shocking True Crime Stories.
Episode 1, The Lobotomist, Ice Picks and Ego Trips.
Walter Jackson Freeman II wasn't some back-alley butcher. He came from a distinguished and long-standing line of American doctors. His grandfather was the first professor of otolaryngology at Yale. His father was a respected surgeon. Freeman? He trained at Yale and the University of Pennsylvania, specializing in neurology. He was brilliant, arrogant, and utterly convinced he could change the world.
By the 1930s, mental health care in America was in crisis. Thousands of people were locked away in overcrowded asylums, suffering from depression, schizophrenia, mania, with no effective treatment, no real understanding of brain chemistry, no pharmaceuticals, just electroshock, insulin therapy, and the padded cell.
It was into that void that the idea of lobotomy emerged. The concept? Sever the connections between the brain's prefrontal cortex and the rest of the brain. The logic went like this: if emotional disturbances originate in the frontal lobes, maybe cutting them off from the rest of the brain would restore calm.
The idea came from Portuguese neurologist Antonio Egas Moniz. In 1935, he performed the first prefrontal leucotomy, drilling holes into the skull and injecting alcohol to destroy neural pathways. Crude? Yes. But Moniz reported that some patients became more docile, more manageable, less tortured by those delusions. It was enough to earn him the Nobel Prize in 1949.
Freeman was inspired. He believed lobotomy was the future. But where Monish was cautious, Freeman was a showman. He wanted speed, simplicity, scale. His answer? The transorbital lobotomy, a procedure he could perform with an ice pick and a rubber mallet. The instrument, which Freeman called an orbitoclast, was used to penetrate the thin bone of the eye socket and sever brain tissue. No need for a surgeon, or a hospital, or even consent in some cases.
The ethical lines weren't just blurred, they were obliterated. And yet, here's the uncomfortable truth. At the time, Freeman wasn't considered a monster. He was praised, admired. He believed, perhaps sincerely, that he was helping people, that he was ending suffering.
So how do we square his methods with the Hippocratic Oath? You know the one, first do no harm. Well, like Monish before him, Freeman would have argued that the ends justified the means, and the greater harm was doing nothing, leaving people to rot in institutions, screaming in padded rooms.
The world didn't yet have antidepressants, or antipsychotic drugs, or modern trauma-informed care. Lobotomy was seen as a last resort, a miracle even. But there's a line between desperation and delusion. And Freeman didn't just cross it, he danced across it with a smile.
He believed he was saving people, giving families their loved ones back. But in reality, he was turning troubled minds into silent shadows.
And if you're wondering whether that disconnect between belief and consequence is a sign of something more pathological, you're not alone.
Because this isn't just a story about bad medicine, it's a story about control, ego, and ultimately, psychopathy.
Operations can be performed under local anesthesia if the patient is sufficiently cooperative.
In 1936, Walter Freeman and neurosurgeon James Watts made history and opened a Pandora's box. Their first lobotomy, performed on a woman named Alice Hood Hammett, was based on a theory imported from Portugal that mental illness could be cut off by severing pathways in the brain.
The idea was to disrupt the communication between the frontal lobes, where reasoning, personality and decision-making reside, and the thalamus, deep within the brain, which processes emotion. The goal? To blunt overwhelming feelings of obsessions, psychosis, despair.
They called it a cure, and when Alice survived and seemed calmer, if emotionally flattened, Freeman was thrilled. But soon he grew impatient. He wasn't a surgeon. He didn't want to wait for Watts, so he invented a new method, faster, simpler, and much, much more dangerous.
He took a standard household ice pick, filed it down, and inserted it through the thin bone at the top of the eye socket, the orbital plate, hammering it into the brain with a mallet. Once inside, he'd sweep the tool side to side, severing the white matter fibres that connect the frontal lobes to the thalamus.
The procedure, known as the transorbital lobotomy, took less than 10 minutes. Freeman didn't use anaesthetic, just a jolt of electricity to knock the patient unconscious. Then ice pick, mallet, scrape, repeat.
He started performing them everywhere, in hospitals, yes, but also in hotel rooms, prison clinics, and eventually his own office. And yes, let's address the myth. Freeman's lobotomobile, a nickname given to his personal van, was real, or at least real enough. Whether he called it that himself is debated, but he did tour the United States in it, performing and promoting lobotomies in over 20 states.
The dura is opened and the cortex is punctured in an avascular area, following which the leucotome and the nasal septum periosteal elevator are introduced.
Some of his patients were shockingly young, distressingly so, in fact. Here's just a handful of examples. Howard Dully, aged 12, lobotomized for being defiant. He survived and later became an advocate, telling his story in a powerful memoir. Helen Mortensen lobotomized 3 times by Freeman. The 3rd procedure killed her. Jenny Snow, aged 23, lobotomized for postpartum depression. She lived, but her cognitive functions never recovered.
Freeman's selection criteria were elastic: depression, anxiety, menopause, sexual deviance, even teen rebellion. He saw the procedure not as a last resort, but a tool for social conformity, a way to make people docile, manageable, and quiet.
The incisions are now deepened by radial stab incisions which push the vessels before them, preventing further bleeding and at the same time interrupting more completely the fibers in the frontal lobe. It is when these remaining fibers are being severed that the patient often becomes disoriented.
But there's one case that casts a long shadow over Freeman's legacy, one you've probably heard of. Her name was Rosemary Kennedy.
I think we are a great country, but we can be a greater country. And I think we're a powerful country, but I think we can be more powerful.
She was the sister of the man who would become the 35th President of the United States, John F. Kennedy. At age 23, Rosemary displayed signs of mood swings, confusion, and occasional aggression. Her father, Joe Kennedy, wanted a solution, something permanent.
Enter Freeman. He lobotomized Rosemary in 1941. During the procedure, she was awake. As Freeman sliced through her brain tissue, she began to fall silent. When she could no longer speak, they stopped.
The result was catastrophic. Rosemary was left with the mental capacity of a toddler. She could no longer walk or talk properly. She was hidden away in an institution for the rest of her life. The family barely mentioned her.
Freeman, incredibly, labelled the operation a success.
A success? Her father never forgave himself. And today, her story is widely seen as a tragedy, a cautionary tale about medical overreach and the price of control.
Incidentally, she was also the aunt of Robert F. Kennedy Jr., conspiracy theorist, anti-vaccine campaigner, and current Secretary of the U.S. Department of Health and Human Services.
I've never been anti-vaccine, but everybody in this room probably believes that I have been, because that's the prevailing narrative.
Make of that what you will.
So, who was Walter Freeman? A rogue doctor obsessed with fixing the unfixable? Or a man so disconnected from the consequences of his actions that he crossed the line into something darker?
Coming up, we assess Freeman's personality through the hare-psychopathy-checklist. Charm, arrogance, lack of remorse. We'll begin to build the case. Let's talk about psychopathy, not the Hollywood version, not Hannibal Lecter or even Ted Bundy, but the clinical definition.
Psychopathy isn't a mental illness in the traditional sense. It's not a disease you can catch or develop. It's a behavioural disorder, a constellation of traits that include superficial charm, callousness, lack of empathy, and manipulativeness.
Psychologists Paul Babiak and Robert Hare, the one who literally wrote the diagnostic checklist, put it this way in their book Snakes in Suits: When Psychopaths Go to Work. Psychopathy is a spectrum. At one end, people are completely normal. At the other end, you find those who meet the full clinical criteria. But in between lies a significant number of individuals with psychopathic features. Their behaviour depends on the particular mix of traits they possess.
That particular mix is what we're interested in, because Walter Jackson Freeman II wasn't violent in the traditional sense. He wasn't sadistic, exactly. However, his cold detachment, his God complex, and his utter disregard for consequences raise serious concerns.
To assess this, we turn to the Hare-Psychopathy-Checklist Revised, or PCLR. It contains 20 traits each scored 0, 1 or 2. A perfect score, if you can call it that, is 40. In the United States, a score of 30 or above is considered psychopathic. In the UK and Europe, the threshold is a little lower, it's 25.
Let's take a quick look at Freeman. Glib charm? Absolutely. Grandiosity? Off the charts. Shallow effect? No question. Callousness? Failure to accept responsibility? And manipulativeness? Tick, tick, tick. And now for the kicker. A touch of irony you couldn't script.
It turns out lobotomy was once used as an experimental treatment for psychopathy itself.
That's right. In the 1940s and 50s, psychiatrists, including Freeman, theorized that severing the frontal lobes might suppress the impulsive antisocial behaviors associated with psychopathy. A 1949 study in the American Journal of Psychiatry even reported cases where lobotomy was used on violent inmates labelled as psychopathic personalities.
So, Freeman may have lobotomized psychopaths in a bid to cure them, all while possibly being one himself.
The blind operating on the blind. Chilling.
But does Freeman's behaviour meet the clinical threshold? Is he truly a psychopath, or just a dangerously misguided crusader?
Coming up, the final years, the collapse of his career, and the one lobotomy that finally stopped him for good.
Walter Jackson Freeman's downfall wasn't a court case. It wasn't a public scandal. It came in the form of a single fatal lobotomy in 1967.
The patient was Helen Mortensen, a woman he'd already lobotomized twice. This third attempt, done in a Californian hospital, was a disaster. She suffered a massive cerebral hemorrhage and died 3 days later.
The hospital barred him from ever operating again. Freeman was 72. His license was intact, but his influence had finally dried up. Antipsychotic drugs like thorazine were already replacing surgical interventions. The lobotomy era was over.
He spent the rest of his life driving across the country, not performing lobotomies, but visiting the patients he'd left behind.
There are quite a few of them scattered through the South, and I guess there's some 42 in Florida alone.
Many of them couldn't speak. Others didn't recognize him. Some were institutionalized for life.
In total, he performed over 3,400 lobotomies. His exact body count is unknown, but at least 100 patients died. Many more were left irreversibly damaged. The true toll? Impossible to measure.
Next time, in part 2 of Psycho Killer the Lobotomist, we revisit Freeman's career from a legal and ethical perspective. Why wasn't he prosecuted? How did the institutions enable him? And how did he see himself right to the very end?
Was it blindness, brilliance, or the chilling logic of a true psychopath?
Plus, a final verdict on his hare-checklist score and a deep dive into how medicine, power, and unchecked ego can blur the line between healer and killer.
And coming this autumn, you'll be interested to know our new companion series is out, The A to Z of Psychopaths, short, sharp episodes exploring the darkest minds in history, from the infamous to the totally forgotten.
Subscribe now so you don't miss a single one. We're on Spotify, Apple, YouTube, wherever you get your true crime fix.
And if you want early access, ad-free episodes and exclusive bonus content, head over to patreon.com/psycho-killer. A huge thank you to our amazing supporters. We literally couldn't make this show without you.
If you liked what you've heard, leave us a 5-star review. It helps more than you know.
I'm Simon Ford.
I'm Jack Morrell.
And this is Psycho Killer, Shocking True Crime Stories.